Knock, knock, knock. Hello, my name is Amber. I'm going to be the student nurse taking care of you today. I'm going to be doing a thorough cardiac and neck vessel exam. So to get started, I'm going to be doing my hand hygiene, and then I'm going to make sure that the bed is at 30 degrees, and then make sure there are no pillows present. So I'm going to start by asking you some questions. So do you know where you are?
Your house.
Do you know why you're here?
A checkup.
Do you know what today's date is?
October 11th, 2020.
And then do you know who the current president is?
Trump.
Okay, so the patient is A times 4. And then can I have your hand, please? So capillary refill is less than 3 seconds, and then the patient's skin is warm, it's dry, it's soft, it's smooth, and then the color is consistent with ethnicity. So I'm going to get started by inspecting the anterior chest. And then I'm going to palpate. Okay, so there were no lifts or heaves observed, and then there were no thrills or any other pulsations felt upon palpation. So now I'm going to inspect the internal and external jugular veins. So if you could look that way for me. And then can I look the other way? Okay, so I observed a mild internal and external jugular vein pulsation bilaterally. So now I'm going to auscultate. So first I'm going to start at the aortic valve and then move to the pulmonic, Erb's point, and then tricuspid. So the aortic valve is at the right sternal border at the second intercostal space. And the pulmonic valve is at the second intercostal space on the left sternal border. Erb's point is at the third intercostal space. And then the tricuspid valve is at the fourth intercostal space. And then once more with the bell. Okay, so S1 and S2 are crisp. They're not diminished or accentuated. The rhythm is regular, and then there are no murmurs or other heart sounds. So now I'm going to auscultate the carotid arteries. So if you could turn. And then I'm going to palpate. Okay, so the carotid arteries were auscultated, there are no bruits or murmurs heard, and then the pulse bilaterally was 1+. So now I'm going to sit you up and re-auscultate the heart sounds. If you could just lean forward a little bit for me. So again, we're going to do the aortic valve to the pulmonic, to Erb's point, and then to the tricuspid valve with both the diaphragm and the bell. And then again with the bell. Okay, so S1 and S2 are crisp, they're not diminished or accentuated, and then the rhythm is regular, and then there are no murmurs or other heart sounds. So now I'm going to have you lay back and I'm going to assess the PMI. So the PMI is going to be at the 5th intercostal space at the mid-clavicular line. And then if you could just lay on your left side with your left arm up. Then again with the bell. Okay, so S1 and S2 are crisp, not diminished or accentuated, and then the rhythm was regular and there were no murmurs or other heart sounds. And then lastly, I'm going to palpate the aorta. Okay, so the aorta is palpated, there was no pain or tenderness, and then the pulsation was in an anterior direction.